Today we're going to talk specifically about neck liposuction. The term that I prefer to use is lipocontouring. I think it's more descriptive of how I do it versus the idea of liposuctioning. I want to move away from a broader topic and specify more of a specific topic. I believe that anyone over 45 years old or so is not a great candidate for neck liposuction as a standalone procedure. They most oftentimes need some kind of lifting procedure or some kind of neck work that's external or not external, but more elaborate than just simple neck liposuction. The reason being is that as we get into our mid-40s and beyond, the skin laxity becomes more severe, the musculature in the neck becomes more evident, and a lot of liposuction of the neck can actually make you look worse. In fact, I remember a lady that was I hadn't seen for about 2 years. I had told her, don't go get the neck liposuction. She was about 51, 52 years old. She came back and I hadn't seen her for 2 years and was very, very distraught about this. And I said, what's going on? She says, well, she had a liposuction now. She can see the bands more. I said, well, and she said, I should have trusted you, Dr. Lamb, not to have it done. Well, I actually fixed most of it by putting fat back in with a concurrent facial fat transfer for her. So what are we talking about then? We're talking about a more specific age group of someone from teenage years up until about late 30s or so would be an ideal candidate for neck liposuction work. So I usually tell my patients that it's a better idea to think about it earlier than later so that I can do some work for them at that point. So what do I do in the neck? What are some of the limitations? What are some of the past problems I've had? What are some of the things that I've done to improve this technique? The best way to think about the neck is that there's two components of fat. There's fat below the muscle. The muscle is the platysma muscle, the muscle that it becomes a turkey gobbler as we get older, inside the muscle. So below actually means above, it means inside, and then outside of the muscle. There's many techniques to try to get the fat from inside the muscle. I've done that, and I've seen sometimes a problem is that it looks a little inverted and there looks like a little ridging when the muscle, after it's been tightened, can actually loosen. So I don't really tighten muscles. I do more facelifting work when I have a person that requires that technique. So what I'm saying is that there's going to be some limitations if the fat, depends where the fat is found. The other thing that's really important when I'm looking at a neck, the reason I like the word neck lipocontouring over neck liposuction is that liposuction to me is a very indiscriminate, quick passing a cannula and just suctioning some fat out. And it doesn't have the artistic capacity to make a neck look better. Let me explain what that means. The neck liposuction I do when I need to, but let me explain how I do it so I think it'll be more descriptive and understand this better. After the tiny incision is made and I look at the entire tissue planes of where the excess fat is, unlike neck liposuction, which is just passing a cannula and suction some fat and walk out the door, I'll actually look into that area and look at the terrain of where the excess is. And I will remember where the terrain of excess was on the preoperative view and on a photograph that's in the operating room. So what I'll do is, let's say I see just this massive amount of fat all the way across the neck. Well, the first move is to debulk all that using a very even approach of neck liposuction. But neck liposuction to me is a preliminary or precursor treatment that I'm going to do when I'm actually going to work on the neck. So at this point what I'm doing is I'm looking for where the excess is. I remember there's a gentleman, Paul, that did a great video journey where I did a large chin implant with neck contouring. I did no liposuction for him because if you just suction all the, he didn't have a big neck, he just had two little balls of fat here, and if I just suction all his neck out, he would actually look older because all this would have been skeletonized. And as you know, I do facial fat transfer, so I'm just not just going to knee-jerk liposuction a neck because you think you need it. I'm going to do it only if I need to. But in his situation, instead of going in there and suctioning all the neck out, which would have been actually a real problem, I remember on his preoperative photograph where the problem was. I saw the extra fat. I looked in there and I could see the two bulges, and I just sculpted down those two excesses. The other thing that I do besides focusing on that area is, let's say that you don't have what's called a cervical mental break. What that means is the area in the low neck where it breaks down like this and creates a little bit of a contour change. I'm going to work in there and actually create one by just sculpting the fat along the cervical mental junction so that I can create a little bit more of angulation change. It probably will never be like this, but instead of the neck looking like this on a profile, if I can create a little bit of a visual break like this, it creates the illusion of a better neck plane. So sculpting artistically is very, very important. There's one final point I want to mention about why sculpting, besides not overly removing fat for no reason. It's also a visual idea of balance. You may have remembered remembered an analogy of balance. I'm going to take it back a notch so you understand this, is that if I asked you on a digital screen, put a glass of water on there and asked you how big this glass of water is, you would say, I have no reference point how big this glass of water is. But if I put a tiny one next to it, this looks visually big. If I put a big one next to it, this looks visually small. So the difference is when I'm looking at the extra fat in the neck, if this is the central problem and I take fat everywhere off the neck, then the center will still be proportionally smaller. It's still proportionally the same size as everything else, and your brain will not see this as a differential. So what I would do in that situation is if there's an excess fat everywhere, I'll liposuction it down as a precursor. Then I'll look for where is the extra fat in the neck. And so it will probably be just in the center. And if I'm working in an area, I'll take more off the center so your sides look smaller. And that's the idea of balance. So it's better to use the word lipocontouring, in my hands at least, and it's more of a delicate sculpting maneuver of looking where the excess pockets are so I can target remove what the problem is, rather than mechanically, indiscriminately just suction fat all over the place, because that is considered the right thing to do. It actually oftentimes is the wrong thing to do.